Good morning, everybody. My name is Dr. Faizan Aziz. I'm a consultant interventional pulmonologist at Virinchi Hospitals, Hyderabad. Today, on the occasion of World Lung Day, I'm here to brief you about a lung condition called as the ILD or the interstitial lung disease. Interstitial lung disease basically encompasses a wide range of diseases. Basically, what happens is the lung is supposed to be a spongy structure, wherein when the air goes in, it expands, and when the air is exhaled out, it contracts. So this ability to contract and expand, the contractibility, the elastic property of the lung is hampered in this condition. That is the ILD, wherein lung becomes more thick, it becomes fibrotic, it becomes hard, wherein the patient is unable to breathe in properly. The patient has constant complaints of difficulty in breathing, especially which is aggravated on exertion. The patient is unable to walk a few steps during severe conditions. Patient has intermittent recurrent cough, dry cough, and the patient, because of a hampered compromised lung, is an easy subject to catch any sort of a lung infection, viral flus, pneumonia, a lot of lung infections. So these are the main presentations of patients with ILD, with dyspnea, difficulty in breathing being the most troublesome for the patient. So what exactly causes ILD? ILD, firstly, it can be an autoimmune condition. It can be related to a connective tissue disorder, wherein the damage caused to the lung is being produced by the body itself, which comes under a condition called as autoimmune diseases. That is first, which is the most common type of ILD. The second can be smoking related. It can be exposure to dust. It can be exposure to smoke, cigarette smoking, exposure to allergens in the atmosphere. Pigeon and bird exposure also cause a sort of an ILD. There are a few medications which cause ILD. So these basically are the predisposing factors for ILD. So what exactly you need to do when a patient is, how do you diagnose ILD? Firstly, diagnosis is basis of a CT scan, wherein you do a CT chest imaging to look for the earliest signs of ILD, earliest sign of fibrosis, because the damage once done is irreparable. It leads to a permanent damage. So the early you pick it up on a CT scan, the better you get to know the disease, and you can start off with the treatment early, because you need to prevent the progression of the ILD. Supposing if it is a progressing sort of an ILD, it has to be dealt with more aggressively, because it can be fatal. Many of the patients, they become oxygen dependent, and they have a very difficult life, eventually leading to a lung transplantation. That will be the only the modality of treatment with unpredictable outcomes. So getting a diagnosis at an early stage, treating it appropriately with steroids, with immunosuppression, depending on the stage of the ILD, is the way you go about it. So I tell all my patients to get the diagnosis in an early stage, get yourself evaluated in an early stage, quit smoking, quit exposure to any allergens which can predispose to ILD, get yourself vaccinated, have periodic checkups with your lung doctor, with your pulmonologist, because if there is anything on these lines, the early you diagnose it, the better is the prognosis. Like I always say, early diagnosis is better prognosis and better outcomes. Thank you.